Hi and welcome. I'm trying to learn history today, enlarged adenoid. And after we've done that, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training with disability owners, this is part 4, something of the adenoid, enlarged adenoid. Now, introduction, we have a little problem with introduction, a bit stuck there because there's not said what the adenoid is now normal and what is now a problem when someone has enlarged adenoid. So, what the idea is just, we're just assuming whatever is told you that is the problem, or the other way around, we are just telling now in our presentation what the problem is with an enlarged adenoid. We don't have to say now what it is now when who has the what. We're just going to read it, but we're basically going to say what I just said. The adenoid is a single pad of lymphoid tissue, the tissue that helps to protect the body from infection. I didn't say that. We're talking about internal anatomy, about diseases, and stuff like that. And this is no medical advice, we're just reading about it. The adenoid is a single pad of lymphoid tissue, the tissue that helps to protect the body from infection. Lying at the back of the nose, close to the point where it joins the mouth cavity. It is small at birth, but begins growing at about the age of 3. It reaches maximum size at about the age of 8, and by puberty no longer causes obstruction. Enlargement of the adenoid may block the opening of your Eustachian tube, the tube that connects the middle ear to the throat into the nose, resulting in otitis media. The adenoid may also obstruct the flow of air from the nose to the throat, forcing the child to breathe through the mouth. The flow of air through the mouth that causes the tonsils to become larger. We looked up where the tonsils are. There's somehow at the top of the mouth in the air canal, deep in behind the nose. I don't get it. Somewhere the tonsils, we don't really say. Now, I don't really understand what the adenoid is doing when. We're just going to say, if it is too big, then that happens. No, but we're going to say what the adenoid is. The adenoid is lymphoid tissue. It is at the back of the nose, is it like back of the nose, close to the mouth cavity. And it is lymphoid tissue, so it is tissue which helps to protect the body. The tissue that helps to protect the body from infections. And what else? And if it is enlarged. So, if it is enlarged, the Eustachian tube, which is normally clearing the middle ear, or how do we say it? The tube that connects the middle ear to the throat, may block the opening of the Eustachian tube into the nose. Oh, that is what the sentence is to be read. Enlargement of the adenoid may block the opening of the Eustachian tube into the nose, resulting in otitis media. That is it. The opening of the Eustachian tube, where it comes out into the nose, or where that now exactly is, that is blocked and it cannot come out. And it could happen with otitis media. Okay, what did we have? It is lymphoid tissue. It is at the back of the nose. It can block the Eustachian tube where it comes to the nose. It can cause otitis media. It can also obstruct the flow of air from the nose to the throat. Also airflow from the nose to the throat. And that can make mouth breathing necessary. The flow of air through the mouth and causes the tonsils to become larger. So the tonsils must be the region where we are affected through breathing through the mouth. We had me on the picture. It was not. The tonsils become larger. We are also in that region. Not to say no. Symptoms: breathing through the mouth, blocked nose, snoring, nasal speech, deafness, and recurrent otitis media. Mouth breathing and the blocked nose, mouth breathing, let's say it like that. Mouth breathing and the blocked nose, and also snore. Why do the tonsils become larger? Is it because of the breathing or through the snoring, or is this what happens? Because what are the differences? Maybe there are some respiratory differences between snoring and breathing through the mouth. And what if these differences causing then specific things? That would be an interesting thing. Maybe a tableau. Breathing through the nose, breathing through the mouth, and snoring causes these and these things. And then all next to each other. Breathing through the mouth, breathing, blocked nose, and snoring, and then also recurrent otitis media. And that is, can't say it completely. Is it an inflammation? So it's just don't say what otitis media is. It's problem of the ear. It's inflation of the middle part of the ear, but I don't know if it's completely right, so I don't say. Recurrent otitis media and deafness. Nasal speech and deafness. Mouth breathing, nose blocked, and nasal speech, snoring, and deafness. Recurrent otitis media. Duration. Mouth breathing and a blocked nose may last for months. Don't really think that we're going to save it because we didn't really understand when the enlarged adenoid happens. Recurrent ear infections or deafness may occur over a period of months or years, and the whole condition can last for months or years. Maybe have it as a little. I don't know what it's called. And if it's called like that, if it's not called like that, and I'm just going to use the word for it, but it would be a problem if it's not called like that in the language, because then it would be slur. Whatever we're going to have. It's I know what it's called, but I'm not completely sure what it's that. But it wouldn't be prophanic if I would use that word. But I think that this is something to say it's a little trump in our hand. So to play the cards. Or trump. Recurrent otitis media. Duration. Mouth breathing. Duration already had it. Current ear over months and years. So it's our little trump in our hand, if we need it. We can say it lasts over months and years. I already pretty far. Causes. Recurring or long-standing infection of the adenoid. Why can the adenoid at all get infected? Has an infection to be through a virus or bacterium? Infection. How does that happen? Treatment in the home. There is no home remedy. It is a normal process of childhood and disability. I don't get that. Is it now that every child has it, or is it just that many children have it? That it's normally happening to children? Or is it that every child has it? And especially unless there are complications. So we're just going to stay away from it. When to consult the doctor. If a child has earache or deafness in one of both ears lasting more than 4 or 5 days. I don't think we're going to say that. It doesn't really make sense when we don't know when the thing happens at all. If a nose is blocked for more than a month and the child is unable to breathe with the mouth closed. But if you would say, we would say, if there's earache or deafness or a blocked nose, then consult the doctor. But this is not medical advice. Also, the video we're preparing is not medical advice, so I don't really have to say it at all. It is advice, we could say it like that, to give a better understanding of the disease, or what it is now. But if a blocked nose or deafness or earache is, then consult the doctor. What the doctor might do: examine the ear and mouth, test to see how well the child can breathe through one nostril at a time, test the hearing, send the child to an ear, nose and throat specialist. The specialist may decide whether an operation is necessary to remove it. Okay, that is all thing. The specialist may decide that an operation is necessary to remove the adenoid and possibly the tonsils at the same time. What happens when they are removed? They do not have a function. There was a lymphoid pressure protect the body of infection, and that was one of these infections which was a problem with the enlarged adenoid. Now, if it is an infection, then it can't be that originally. Recovery is usually rapid. Outlook: from the age of 8, the adenoid decreases in size and both the risk of complications and symptoms decrease. So I think they're saying that actually almost everyone has an enlarged adenoid. But just by some children it is so worse that there has to be something done about it. So people can have an ear infection because the adenoid is enlarged, which blocks the session tube, clearing the middle ear. From the age of 8, they said it right, from the age of 8, no, they said it wrong. I forgot what I said. The adenoid decreases in size and both risk of complications and symptoms decrease. The specialist's decision to operate on it depends on reaching a balance between symptoms and age of the patient. Another thing is also interesting. Age of patients. Okay, we have it all together, but we don't have time left. That means we need another part for enlarged adenoid. If you were here for medicine, you can go straight to the next part of medicine. We will do now the short impingement training. If you stay and participate in the short impingement training, again, this was no medical advice. We just read about it and speculated about it, so this is no medical advice. If you participate in short impingement training, then it's very honest. We're having good and simple stance, and I forgot what we're doing. We're doing shoulder circuits. We come back and up and in front and down. And not backwards. Front. Down. And now. Long arms, strong fists, and go as far back as you can over shoulders. High up and the front. down, and again back, up, and front, and down, and again up, down, back, and down, and front, up, back, down. And now, next one part, go it into the knees, hinge forward, have a straight back, let the arms hang, and pinch the scapulars together, third. Make fists, lift the arms up, and pinch the scapulars together. Arms up, shoulders up, and again, pinch the scapulars together. Make fists, lift the arms up, and pinch the scapulars together. And shoulders down. And another round. No, not another round. We're doing the cheat jump, what are we doing now? So end of the knees, hinge forward with the round back, with the arms hang, make fists, lift the arms to the inside, lift the arms high up, bring them together, straight up, bring shoulders down and together. Arms high up and together, shoulders down, together. And release, and another round. End of the knees, hinge forward, round back, lift the arms hang, make fists, turn the arms to the inside, lift the arms high up, bring them together, shoulders down and back, and together. Arms high up, and together, shoulders down, and together. And let the arms loose. And now, lift the arms up, and then down again. If this or any other exercise causes pain, we now do it. Now the arms to the side, and the front. And now we'll both lift up. So in the same sense, long arms, shoulders down and together. And then the arms to the inside. Arms to the outside, shoulders down and together. And change. Arms to the inside, shoulders down and together. Last time changing, arms to the outside, shoulders down and together. And release. Next exercise, the arms up to the side, a bit in front, shoulders down and together. Change arms back, shoulders up and front. And again, the shoulders in front, shoulders down. No, the arms in front, shoulders down and together. So the arms to the pronation, shoulders. And change the last side, arms supination and shoulders into. I think it's anterior scapular. And release. And now the shrug, the arms up, shoulders, and let go down. And another time. Down. And now the pretzel converse. Arms together, down and to the inside. And now stand up. I have a sock or whatever with a long arm to the outside, and then fall down. Try to get it again. And on the outside. Stretching, 1 hour front, the elephant trunk. Arm back, down, pull the arm in, have flat fingers, stretch your legs, your arm, go with back with shoulder, down up to the sky. So, yeah, shoulder back, down, pull the arm in, have flat fingers, stretch your legs, your arm, go with back with the shoulder, turn the palm up to the sky. The other arm in front, shoulders back, down, pull the arm in, have flat fingers, stretch, turn your legs, your arm, go with back with the shoulder, turn the palm up to the sky. Now, why is it now no problem anymore when the people are older? It's just with the size decreases, was written, the size of the adenoid decreases, and now infections are not so much a problem anymore. Or is it just with the cavity itself gets bigger and now the adenoid has the same size as the problem? But it was written that way, so if I have measured properly, it is that way. So they get still these infections, but the overall size has decreased. So that now, even with infections and swelling. It's no problem. I read something about the stitching tubes, and I think it was written that children have often a ear block because it is more horizontal and less vertical because the face gets longer when people get older. But where was it written? It was just an idea that they weren't so sure about it. Now, if they don't know that, horizontal and vertical, do we know any other thing? I think very much, and